Welcome to the American Academy of Grief Counseling's Videogram on guilt and trauma. And this video is associated with both our grief counseling certification program as well as our stress management consulting program. And the idea of trauma and stress and PTSD are something that is covered in both programs to some extent. The idea of guilt existing in trauma is something that is very common, and it's something that this video is going to look to explore a little bit and also offer some solutions to it. Naturally, guilt is an emotion. It's an emotion that coincides with one's conscience. So it's very importantly tied to justice and forgiveness itself. So if we have a sense of justice and we do not fulfill that justice, then we have a sense of guilt for not doing one's duty. Also, not seeking forgiveness can be a byproduct of not having enough guilt. So guilt is good when it is a driving device to correct a wrong. However, lack of guilt can sometimes be very bad, and we see that in situations with sociopaths who have no conscience and they do whatever they want and they don't even feel that properly formed emotion of guilt to guide them to make reconciliation to a wrong that was done. So they continue to do wrong and wrong and wrong. Guilt, however, can also become pathological, especially when guilt exists with various distortions resulting from a situation one partook in. So sometimes the guilt should be there, sometimes it shouldn't be. A healthy individual, a healthy conscience has guilt when they should. An injured person through a act of trauma, someone who's mentally gone through a severe trauma can sometimes have guilt and they shouldn't. It's just when it comes to more pathological individuals where no guilt exists that it's always bad. So it can be good at some points, but also bad in some points as well. And what we're looking at is when guilt is more of a burden. It's not necessarily something that's helping you rectify a wrong, but it is in reality an anchor tied around your neck, holding you back from proper healing and proper understanding. So whenever something occurs, something is processed and experienced, it has time to be stored properly and go through. But through PTSD, post-traumatic stress disorder, where situations arise that are not normal, that are not everyday, they are actually very traumatic, very inhumane, whether due to other humans inflicting cruelty upon others or through natural catastrophe. Sometimes that trauma isn't processed properly and it's not put into the long-term memory. It's just fractured and distorted within the short-term memory itself. And in that process or lack of process, sometimes how one acts can create a guilt later, because the guilt is not properly processed, whether it is a situation where you should feel guilty or a situation where you should not feel guilty. So if the distortions of the situation of the trauma are not properly identified, then guilt naturally becomes distorted itself and then becomes a problem. They become actually even a prison from healing when one is too held to their guilt. And in these types of distortions, individuals might either see themselves 100% guilty for a situation or 0%. And it is important to have a healthy understanding of the role you actually did play in a traumatic situation. But again, because it was not properly stored in long-term memory and it was fractured in the short term, the distortions don't really allow you to see the picture the way it should be. And that's why we have the image here of someone being really imprisoned by their own guilt in this regard. So the guilt is due to maybe something that the individual felt in the trauma, which might be very natural. If they felt fear, relief, enjoyment, or even hate in the event that occurred. Obviously, maybe sometimes soldiers feel fear in the battlefield. And when bad things happen, they might feel guilt. Others might be individuals who had a lot of strong distaste for the situation and hate for an enemy. And in that situation of trauma, they did things that are not really who they are or what they are proud of and what they did. Or maybe even some during sexual abuse, there might have been a point of, well, they hated it, a mode of enjoyment, and they feel guilt for that. So guilt can emerge in a lot of these situations. So a person can feel guilty for having certain emotions or doing things they had to do, for saving oneself, having to kill, making a mistake, or wishing even to die in the situation. So it is a situation that is packed with a lot of trauma and a lot of, in some cases, regret, but the situation isn't remembered properly. So more distortions come in. And as they come in, we see other examples. A person's feeling guilty for failing to save others. We see that a lot with firefighters. Not taking better precautions. Maybe they thought, if I would have done this, maybe that wouldn't have occurred. And they start second guessing. Freezing during combat, not stopping the abuse sooner, maybe of someone that you loved, or the individual who was abused didn't speak up sooner, or failing to say goodbye to a loved one and dying with anger between them. So the person in these types of situations, they inflict upon themselves a personal penance and suffering to feel like they have to make up for this mistake and guilt that's really distorted. And it becomes a punishment and a prison, so to speak, not allowing the individual to find the healing that they truly need. And in this, the person begins to feel that they themselves are broken, that they're flawed, undeserving of love, undeserving of healing because of this distortion that now exists due to the moment of trauma and the inability to process that trauma properly. So there are cognitive approaches that can be applied to this. Usually a therapist, and these types of things aren't dealt just with certified grief counselors. We're dealing with a much higher level of therapy where the individual can be grief counselor, but they have to also be a licensed counselor by the state. And in these types of situations, cognitive approaches and therapies can be worked out between the therapist and the patient themselves. And one of the things that they do within this cognitive approach is have the individual replay and verbalize the details of the event. Now you can see why it's so important that it's a licensed therapist, because people who experience PTSD, if they're not properly in professional hands and they start to recount events, they can go into a flashback, they could go into a mental distraught state. So it's very important that when dealing with trauma and going back to that event, and individuals verbalize that you have a therapist who has everything under complete control. So the individual would, under the care of a therapist, verbalize the details of the event. Maybe it was a battle, maybe it was sexual abuse, whatever type of trauma that occurred. And then the individual relates, after telling the story, what was one's fault? What were their faults? What percentage do you hold oneself to in regards to why this occurred? So if a lieutenant takes his troops into a battle area and there's an explosion, some of his soldiers die, how much was the lieutenant at fault for this? What percentage, so to speak? And whatever percentage he says initially, say he says he's 100% at fault, a therapist will then challenge some of the events and ask for a possible recalculation, meaning, well, you say you're 100%, did you fire the rocket that exploded and killed some of your men? And obviously the lieutenant would respond no. And that would begin to lower his guilt distortion from 100% maybe to 75. And the therapist continues to work on it until it can come to a point where this is what you could have done and this is what you couldn't have done. So what is your true guilt ratio and to make a better assessment? And it also helps with the trauma itself, better placing it in a long-term memory, better placement of that memory. And in that recovery, it's important to attack these distortions, distinguishing between guilt and concern. A lot of individuals have concerns when they're in a situation of trauma, of intense action that's taking place. And in it, individuals give a little bit more guilt for the concern in terms of what they place as their fault versus what they were worried about and what they wanted to stop but couldn't. So this is where accepting limits and imperfections of self become very important. In these events that happen so fast, there are limitations to what an individual can do. There are also imperfections that exist in everyone. Many times individuals with PTSD and guilt within their grief are facing Herculean ideals of themselves, and they place themselves and judge themselves harder than they would judge another human being. And they're unfairly, in these cases, judging themselves. And this is making a feeling of guilt remain within them. So understanding decisions during duress is very important. I'll read them off right here. What were the choices in the moment? What was one's experience with the situation, maybe beforehand or within it? What options remained? What were the best options, maybe? Did one possess all the information within this situation that was happening in a split second? Was there time to weigh all these decisions while everything was going on? Were the outcomes of each decision you made clear as day? What was one's intention in carrying out these actions? And was one at that time emotionally stable because of the duress that was occurring? So look at all those questions and how many thoughts are to be processed within a moment's notice, especially in battle, especially when one is being assaulted. How one responds and reacts, and what one can control and what one cannot control, and doing one's best and knowing you did your best, but still bad things occurred. So it's important then to face these distortions because you weren't able to, the individual was not able to during the traumatic event, to process and to face these distortions, to put guilt at its proper place, to put guilt and weigh it within its proper proportion so that healing can occur. It's also important, as a last note, to separate guilt from shame. Many individuals feel that what they did makes them shameful and a person who is undeserving. Maybe they acted a certain way due to a battle and it was not becoming of them or wasn't anything like them, and they might be experiencing shame on how they acted. And it's very important to identify that shame and to understand why it occurred and to separate the guilt from that shame itself. Other techniques against what we can call guilt monsters are imagine speaking to oneself and actually judging oneself as if you are talking to another person. And what we find in this is we tend to be more lenient with others than with ourselves. So speaking to oneself objectively sometimes helps one find a more proportionate value in regards to what one could do or not do. Spiritual visualization of healing is another type of technique one can use against guilt monsters. And in that, you visualize oneself being healed from the guilt, and you focus on a part of your body and just feel that visualization, and that can produce changes within the body, believe it or not. It can increase certain hormones that lead to healing, and it is a state of mind. And one with positivity tends to heal more so than one with negativity. Preparation for the future is another technique. that can be utilized if you're facing guilt monsters. And you can say, well, it happened. It is in the past. Whatever happened, whatever I did wrong, but in the future, I can prevent what has occurred through better preparation and understanding of what I did wrong. So you start to feel less guilty and more prepared so that whatever occurred does not repeat. It's sort of like making some good out of the past and trying to use that good to make a better future out of it. And in a way, it's looking back through your life and seeing, well, I got to love the good and the bad, and I got to see how the bad can make me better for the future. So here we have our grief counseling certification link, as well as our stress management consulting link. Our office phone is 330-652-7776, and our email is info@aihcp.org. So if individuals are dealing with guilt, the emotion itself is not a bad thing, as we illustrated in the beginning, but due to trauma, things can become distorted and not processed properly within the long-term memory, creating distortions about the events and also leading to an disproportionate amount of guilt. Sometimes the guilt is good, sometimes the guilt is very bad and pathological. It's important to face guilt distortions, to face guilt monsters, and to find the therapy needed to remove that guilt or properly correlate that guilt so that one can find the healing that they need. I'd like to thank you for listening and have a good day.